Hi everybody, so this is just a short video, just some tips and information on what to do if you're getting any bleeding gums. We have had some calls over this period about patients who had some bleeding gums and they're a bit worried, so I'm just going to give you a few tips and bits of information. Hopefully most of it you will know already, but it should hopefully just be a bit of reassurance for you. So of course, bleeding gums are exceptionally common across the general population, but if there's consistently blood coming out, if you're getting more than just a little spot when you spit out after brushing, then we want to make sure we're keeping the area nice and clean. And often it's just down to the fact that we may have missed a little bit here or there. If you've got a crown, if you've got bridges, if you've got implants, all of these things can make it a little bit trickier to get around all those areas to make sure they're nice and clean. So firstly, of course, the most basic thing is making sure that the teeth are nice and clean with good brushing, making sure we're using either our manual or our electric toothbrush, whichever it is that you're using, making sure we're getting the cleaning all the way around the gum line, okay? So aiming at the gum, because that's where the inflammation is going to develop, and making sure you're doing little circles all the way around. Your electric toothbrush, if it has a round head, it will do the little circles automatically for you. But making sure you do that. What you will notice is that if you have bleeding gums and you suddenly start improving your cleaning, so after this video you follow all the little tips, you'll actually notice that the bleeding, you may actually get a little bit worse for a few days as you're getting into all those little areas, and then the bleeding should subside and then you should be fine. The gum should be nice and healthy. Because it'll take the mouth a few days just to heal. So once you've done all your brushing around the outside with your toothbrush and the inside, don't forget we want to make sure that we're getting in here as well, okay, as well as on the outside. We then want to make sure we are cleaning in between the teeth. So we all know there's multiple ways to clean in between the teeth. We can use normal floss, okay, there's normal floss which you can use, making sure that that is going down and hugging around the tooth down to the gum line and then back up. Some patients don't like using floss, so we want to make sure we're using other things. So there's other things such as interdenta brushes, TP brushes. Most of our patients are already using them, which is fantastic. For those of you that don't, it's called TP, T-E-P-E, and you can buy an assorted range of colours. They come in different sizes. I would encourage you, if you've never used them before, to buy an assorted pack. You can buy them off Amazon or most places, and you find the size that fits snugly. Now it shouldn't just fly through, because then it's not touching sides and it's not effective. But you shouldn't have to force it, because then it's going to cause you trauma and will actually hurt you and cause bleeding unnecessarily. And the way we use them is we just aim them at the gum and we just go in between like this, okay? And we just want to make sure you're going all the way through. Every single tooth all the way around, the front ones as well, okay? Just like this. And as it's going through, it should be scrubbing the gum line, putting a little bit of pressure against each tooth either side of the gap. And you'll find that there will be some inflammation when you use that, because most patients, when they're brushing normally, that's fine, but the toothbrush can't get in between the teeth. And those are the areas which end up bleeding when we start brushing properly. So don't worry if it does bleed more after using those brushes. It's actually a sign that you are getting to the areas and you're cleaning properly. For those patients who have bridges or implants, there's an array of products out there. There's different types of implant floss. They've got a hard end, so you can feed it underneath the bridge, and a softer, the floss in between, and you can pass it underneath the bridge work and forwards and backwards to make sure that area is really clean, because it's really, really important to make sure that all the gums are kept nice and healthy and clean. Again, they may start to bleed more than they were before when you start doing all these little techniques, but that is often a sign that you're now getting into those harder to reach areas and that the inflammation should settle down pretty quickly. On top of that, so that's always going to be your first, the brushing, the flossing, the interdenta brushes, so physically removing any plaque and inflammation. Then you can move on to additional things such as mouthwashes. The one we recommend here is Curacept, and it's an antibacterial mouthwash. It's very good. There's no real risks of discoloration of the teeth, which some people have with Corsidil. But again, Corsidil is another option which you can of course use. When you make sure you do this after you've brushed, you can even dip your little TP brushes into a cap full of Corsidil or Curacept and run it through the teeth, run it through underneath the bridges as well. And that will keep everything nice and clean and help flush any residual bacteria out. You can also get something called Peroxyl mouthwash, So this is hydrogen peroxide, similar to what you would use to bleach your teeth. It is quite strong. You can buy it over the counter from a pharmacy or online. You do want to dilute it, so I generally say do a quarter, so one part of the mouthwash to 3 or 4 parts of water, because it's quite strong. But don't use it for more than 1 week at a time, and then you can move on to something else, a different mouthwash. But it is quite strong. Again, you can dip your TP brush into it to run it through the teeth and the gums. It's quite a soapy taste, the Peroxil, so don't be put off by that. But it's very, very good, and that's really if you're